Okay, in this video, I'm going to go over areas of focus for your readings in the section use of the manual. Okay, so sometimes, by the way, you're going to see me looking down at my book, and other times you're going to see me looking at the screen when I'm doing these videos. So sometimes I parts of the book I've read in the book and parts of it I've read on my digital version. So it just sort of depends on the time of day and what I'm doing, or if I'm like can't take looking at the computer anymore and I just want to read it in the book, or sort of go back and forth on that. Anyway, so um, approach to clinical case for formulation. That's a big part of what we're doing in all of this. So definitely I want you to pay close attention to that opening section there, because that is about that again. That's the process, right? So central focus. Well, a primary theme of this course, probably a better way to say it, is going through that process over and over again of collecting data, mapping data to best fitting criteria, mapping the combination of criteria you're finding given the data into the best fitting diagnosis, and then making sure you're pulling in all that other information about the person's social, cultural um, elements of their lives, their circumstances, their micro circumstances, macro circumstances, all that. You're factoring that all in to how they're presenting to you and your interpretation of what's happening with them and what they're experiencing from a diagnostic standpoint. All right. So, and then from there, of course, formulating a plan that's truly individualized and tailored to that person or that couple or that family. All right. So, elements of a diagnosis also good to 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 pay attention to. Again, it gets to us. How do we formulate diagnosis in a methodical way that we can clearly explain how we arrived at that diagnosis, which is very important um, in many contexts. Subtypes and specifiers. This is one that tends to uh, get confusing for students and people in general. So I've added some graphs to the some graphics to the lecture part that you'll see when we get there. Help with that. I don't want you to angst over this too much. This is not make or break material. It's not, you're not going to have 10 questions just on subtypes and specifiers. We just want to make sure you feel like you understand the difference. And I think the lecture, what I put in the lecture, hopefully will help with that. All right. The use of other specified or unspecified. I think this is an important section because many times, and this will be uh, often the case with our case studies, because we are going to have intentionally limited information, right? We're not going to have like full 60-minute assessments or 90-minute assessments in our virtual case studies. These are going to be 10-minute or so clips from which we need to try to pull as much data as we can about our fictional clients. Okay, and so a lot of times that leads us to um, uh, needing to use unspecified or other specified pending more data. Okay. Um, so that's that. Use of clinical judgment. That's something the theme will talk a lot about. Read that section. I think that'll be self-evident, but we'll the DSM continues. We're not machines, I guess, is what the point, right? That there's a very human process to this. There's a very real reason why, although people will increasingly use AI and apps and internet to self-diagnose, and why clinicians may even increasingly use um, technologies, AI type of technology to create diagnoses. It does not replace, and maybe other people feel differently, but I feel pretty strongly. There's no way that is going to replace, at least any time in our lifetimes, the human element and human clinical judgment. Okay, so why what you're doing here is so important. Clinical criteria, coding procedures, definitely things you want to get familiar with. How you write up that diagnosis and make sure that you're and look, in some contexts it's more important than others, but in general you want to try to make sure your assessment write-ups are really professional looking. You want people to take it seriously. Okay, and sometimes you're advocating for a client and are making sure that your write-ups look really professional. Of course, here in the exercise will be a tad more informal, so we don't have an assignment where you write up what a formal assessment looks like, but we can certainly talk about it, in discussion, okay, online. Principal versus provisional diagnosis, definitely be familiar with that. And we'll definitely be talking when we get to the substance use disorder section about um, uh, the interaction between substance use, whether it meets use disorder criteria or not, and other mental health conditions and illnesses, and even recovery from traumatic injury. Those are things those are concepts we'll touch on. Um, Provisional diagnosis, again, I think that's important because in many contexts, particularly when you're working in emergency care or crisis response of some sort, where you don't necessarily get a whole lot of time with the clients you're working with, oftentimes you're formulating a provisional diagnosis based on the amount of data you're able to get in a slice of time that you have. And that'll often be the case with our clinical case studies, because again, it's just not practical for us to do full long assessment videos. Okay. Substance induced and concepts of independent mental disorders. Just make sure you feel comfortable with those things. I'll have a little bit more about that in the lecture material. How other medical conditions interface with what you might be seeing from a behavioral health standpoint with the client. So just to get familiar with that. And then at the end, the types of information in the DSM-TR text, you might think about those, what you see in bold there on those pages as like a vocabulary, terminologies that are useful to have a familiarity with in this course and in your work, using the DSM. So you might think of those as terms that you want to at least have familiarity with, because those might come up on exam questions. You don't have to memorize them. This work we're doing in this course is not about memorization. It's about building a work and familiarity so that you sort of know where to go, have a sense of where to go in the DSM and what to call back to and what to pull in. It's not about memorizing the DSM by any means. Okay. Other conditions that may be a focus of clinical attention is a focus of next week. So it sort of just ends there, and we'll pick that. The section ends there, and we'll pick that up next week. So I think that should cover everything that you'll need for the use of the manual section in terms of reading it and just what to focus on. Okay.